Continuing our in-depth coverage on the opioid crisis, Denver is now testing for drugs like fentanyl at its wastewater treatment facility. They did something similar during the pandemic, testing for COVID to find out how prevalent it was in the population here. So we wanted to know how exactly they plan to use this data. Denver 7's Ryan Fish is looking into it.
Be thankful this isn't smell-o-vision.
The water that's straight from people's houses and businesses all across Metro Denver.
A river of wastewater. This facility in North Denver treats about 130 million gallons of it every day before sending it back into the South Platte River. But some of this sewage is taken out and tested instead.
And wastewater-based epidemiology has been around for a long time, but since COVID, it's really taken off.
Colorado health officials test wastewater for infectious diseases. Now the Denver Department of Public Health and Environment is looking for signs of opioids like fentanyl and xylazine and drugs like cocaine and meth. These samples represent about 750,000 people across the metro.
We're able to see over time, based on the weekly samples, if there's higher or lower levels of specific substances in the wastewater. We're able to kind of track that over time too and see if there are trends based on the time of year or after certain events.
The city sends the samples to a lab in Massachusetts, which then sends back the data. But the city isn't ready to share any trends yet.
We want to make sure that there's enough context around what it means.
Denver is about halfway through a 3-year pilot program funded by opioid crisis settlement money. The city's received millions of it already, but this project only costs about $50,000 a year.
And it allows us to scale up if it's the Denver Opioid Abatement Council or DDPHE decide that that's the direction they want to go.
I think it's just really cool that you can see as much as we can see with just a single water sample.
There's a wealth of data out there that we're trying to lay over to just get a better picture.
It's a dirty job, but doing it could catch spikes in drug use before they show up in hospitals and overdose deaths.
I mean, the more we understand overdose trends and drug use trends, the more, hopefully, we can respond as a public health department and as a community.
A response they hope will save lives. Ryan Fish, Denver 7.